you know what healthy living is all about? Do you want to know how can you live happier and longer? How about learning about balance, spirituality, and prevention? To know how you can live in harmony with others and how to add balance to your life? Know more about prevention and many, many more of the health topics?
Make sure to listen to Healthy Living. Every Sunday at 3 p.m. on 94.9, the JU radio station. Will be rebroadcasted on Tuesdays at the same time. Healthy Living, prepared and presented by Fida Amin.
Good afternoon, everybody, and welcome to Healthy Living, the place where you can hear all about health in all of our life aspects. Health mean better bodies, better mood, better relations, more happy, and more benefits that can be discovered here at Healthy Living. Today's show discusses mental health. Why mental health? Because mental health is a crucial dimension of overall health and an essential resource for living. It actually influences how we feel, perceive, think, communicate, and understand. Without good mental health, we will not be able to practice our daily life functions properly. Mental health can actually treat many diseases in many areas of our bodies, from enhancing our emotional well-being, treating and preventing several mental illness, to the prevention of something like suicide. So let's ask an expert and see how we can take care of our mental health and try to understand how it can impact our bodies. Coming up next, an interview with Dr. Radwan Bani Mustafa. Good afternoon, Dr. Radwan Bani Mustafa. Thank you for being with us today. Please tell us more about yourself and your work.
Thank you very much for this interview. I am Dr. Radwan Bani Mustafa, Associate Professor of Psychiatry in Medical School, the University of Jordan, and Consultant Psychiatrist at the Jordan Hospital University.
Glad to have you with us here, Doctor. Doctor, we never heard of someone that is saying that I'm going for a doctor to check on my mental health, for example, or even thought that we may get sick mentally. People assume that they're born healthy and they will stay healthy. Do you have anything to say about that?
Yes, actually, research and surveys around the world say roughly that 1 out of 4 to 5 people around the world have a psychiatric problem, a significant one which needs a professional intervention. The most common psychiatric problems people suffer from is anxiety and depression.
So what are the things that we need to do to take care of our mental health? Is it like something in particular, or it's maybe changing our lifestyle?
Well, most of our mental health problems are due to our genetic makeup. We inherit these by our ancestors, so really it is difficult to interfere here. However, our lifestyle may help. Eating the right thing, exercising, learning how to behave, and what type of communication and what type of lifestyle, just like not being involved in drug taking, smoking, alcohol, etc., sleeping enough and eating healthy. All these are good measures to improve our health and mental health.
So there are things that can be done to prevent our mental health. Like, as you said, doctor, if it's genetic and there's nothing we can do about, but still we can go to a specialist and get things treated. But there are still things that we can do. It's not like just to accept the fact that we're not healthy mentally and not do anything about it.
No, sure we can do. We know that environmental factors play a part too. These environmental factors we can manipulate. Sometimes we can manipulate and make things better for us, so we can have less stresses in our life, quality of our relationship will be better, so it will generate less stress on us, so our mental health.
So doing things or taking care of our mental health will pay back. It is good in our future. Do you think that the mental health can be improved, like in another word, are things going to go wrong?
Sure. Living in a less stressful lifestyle will pay off, because the evidence is growing around the world by research that most of health problems, physical health problems, meaning myocardial infarcts, cerebrovascular accident, diabetes, hypertension, cancer, are lifestyle produced problems. So improving health, improving lifestyle, maybe you will have less chances to have cancer, to have hypertension, to have infarcts, to have less obesity, overweight. And there is a strong belief that stress is probably the underlying cause of a lot of our health problems. It is to cancer, to obesity, etc.
So do you think if I couldn't improve my lifestyle on my own, this is really a problem and I have to see a doctor or a psychiatric to help me change my lifestyle? Do you think that there is a problem right there? I mean, when you say that we need to change our lifestyle, can you be more specific and tell us like examples on how to improve our lifestyle to impact our mental health?
I appreciate that in poorish countries in the third world, it's difficult really to live the lifestyle you would like to live due to less than optimum financial resources. At least as much as you can create your own environment. It will have less effect on your health, because we know for sure a person lives under chronic stress will have shorter life, will have more chances to have cancer, to have diabetes, to have common colds, influenza, and all health problems than somebody who is living happily and living relaxed lifestyle.
So do you think, doctor, that people here in Jordan have the full awareness of the importance of this topic?
I'm sure not. I wish they had some awareness of this, because we know for sure and statistically proved that half of the patients who visit different clinics in any hospital around the world, at least one half of them, 50% of them, have psychological problems, either the main cause for the consultation or contributory to it. And this means that people around the world are not aware of the influence of psychological and psychosocial stresses in their life on their health. And unfortunately, doctors do not appreciate this aspect, and a lot of doctors think that if the patient they are assessing have no hypertension, no diabetes, no fever, no blood problems, is healthy. World Health Organization defines health as absence of disease plus psychological, social, spiritual, financial, and everything well-being. So if you are psychologically, socially, or emotionally deprived, you can't be healthy whatsoever.
So, doctor, what you're saying that to have this topic under the spotlight and have it highlighted, we have to start to spread the awareness among doctors themselves. When they give the right diagnosis, they should let the people know that maybe their problems, they need to see a psychiatric to help them, not just physical or medication. Give them medication to be well. Is that what you're saying?
Yeah, sure. I don't blame doctors much because of we all aware of the stigma of mental illness. Everybody, most people think if you go and see a psychiatrist, you are crazy, or you will be pointed out as crazy or whatever.
Thank you so much for bringing that up, because yes, we have this aib thing to go and see a psychiatric, because as you said, doctor, it's just a no topic. No one would want to talk about it. And even if I'm convinced that I need to see a psychiatric, I wouldn't mention it to anyone.
This is exactly because our colleagues, non-psychiatrists, are in a better place to a better place because they are visited readily without any stigma. Any individual can go and visit a GI specialist or cardiologist or endocrinologist. And every medical graduate, every doctor should be able to diagnose and treat anxiety and depression, which are the most common psychiatric problems and prevailing among patients. So it is extremely important that doctors of all specialty should have awareness that physical symptoms that patients present to them, if they can't find a cause for them, should think on psychosocial terms of these symptoms and get them treated not by psychiatrists, not necessarily by psychiatrists, by any medical specialist.
So, doctor, where do we start, or how can we start? Increase the awareness, taking care of our mental health. Where do you think that this problem needs to be addressed?
I think probably we should start from school to tell students that psychological problems can make you sick. Can ache your stomach, your head, your back, your knees, your heart, everywhere. And doctors should always have in the back of their mind when they assess patients that the problems they present may be due to psychological problems.
Well, doctor, do you have any advices or recommendations on how to address mental health? I mean, you've just told us how to address the mental health, but is there any certain advice or you want to give to youth on how to, pay attention to this issue?
Live healthy, do the rights you like to do, have friends, have spare time for yourself, be optimistic for the future. Love yourself and love the life you have been given.
Well, thank you, doctor, for being with us today. We enjoyed our time listening to you and hope to meet with you again in the future to hear more about mental health. Thank you for being with us.
Thank you very much. I hope to see you soon.
Here we are, back with you, our listeners, and more on mental health. So, as we all heard, the doctor did illustrate how our mental status can affect our overall health. So we could be complaining of a certain illness, and the cause can be our mental or psychological health. He actually assured that half of the diseases we could have can be linked to our mental health, or at least related to it. Basically, what we need to understand that mental health or mental illness can take many forms, just as physical illness do. The problem is that mental illness are still feared and misunderstood by many people, but the fear will disappear as people learn more about them. So if you or someone you know have a mental illness, I would encourage them to go see a doctor, because most mental illness can be treated. Now let me give you an example for a serious mental illness that our kids or teenagers can have, and as a parent, you may not recognize or know how to deal with. For an example, depression. Depression can be difficult for us adults, to understand how difficult children's problems can be, because we always look at their problems through adult eyes. But the pressures of growing up can be very hard and challenging for some children. So it is important that we remind ourselves that while their problems may seem unimportant to us, they can feel overwhelming to young people. It's important to take depression in young people seriously. Depression is a type of mental illness called a mood disorder as well. Mood disorders affect the way you feel, which also affects the way you think and act. Recognizing depression in young people can be more difficult than recognizing depression in adults, because young people experience so many changes. You may wonder what's normal and what might be a problem. Also, many children and teens may not want to talk about their feelings or may have their own explanation for their experiences. However, you may still notice some of the following changes. Your child may show signs of being unhappy, worried, guilty, angry, fearful, helpless, hopeless, lonely, and rejected. You can also notice changes in physical health. Your child may start to complain of headaches, general aches, pains that you cannot explain. They may feel tired all the time or have problems eating, sleeping, and so on. Your child may expectedly or unexpectedly gain or lose weight. They can also experience changes in thinking. Your child may say things that indicate low self-esteem, self-dislike, or self-blame. There are changes in behavior as well. Your child might withdraw from others, cry easily, or show less interest in sports, games, or other fun activities that they normally enjoy. They might overreact and have sudden outbursts of anger or tears over small incidents, for an example. So you may ask yourself, what can I do about that? Well, depression is very treatable. Children, teens, and adults can all recover from depression. But for children and teens in particular, early treatment is important so they can get back to their education and other goals as quickly as possible. Support for a young person who experiences depression may come from several different people and places. Your family doctor is often the first place you start, but you may also find support through people like psychiatrists, psychologists, counselors, social workers at school, or peer support workers as well. That was just one example of what can go wrong if we couldn't recognize mental illness or if we ignored dealing with it. So what can we include in our lifestyle or change to maintain healthy mental status and prevent mental illness? The answer is actually very simple. Eating well can actually help you in maintaining a well mental status. There are strong links between what we eat and how we feel. So for an example, caffeine and sugar can have an immediate effect, but food can also have a long-lasting effect on your mental health. Another simple thing that you can do is staying active, which is another way to save your mental health. Experts believe exercise releases chemicals in your brain that make you feel good. Regular exercise can boost your self-esteem and help you concentrate, sleep well, look and feel better. Exercise also keeps the brain and your other vital organs healthy. Accepting who you are can also help you deal with your mental problems. Some of us make people laugh. Some are good at math, and others cook fantastic meals, for an example. We're all different and we're all special. Some of us share our lifestyle with the people who live close to us. Others live very differently. We are all different and no one is having a perfect life. So be yourself and make the best of your life. And talking about your feelings can help you stay in good mental health and deal with times when you feel troubled. It's part of taking charge of your well-being and doing what you can to stay healthy. So don't be afraid of sharing your feelings with someone who cares and someone you can trust. What else you can do? You can actually take a break. Sometimes of this busy lifestyle, a change of scene or a change of pace is good for your mental health. It could be a 5-minute pause from cleaning your kitchen, a half-hour lunch break at work, or a weekend exploring somewhere new. A few minutes can be enough to de-stress you. Do something you are good about. What to do, or what do you love to do? What activities can you lose yourself in? What did you love doing in the past? Enjoying yourself helps beat stress. Doing an activity you enjoy probably means you are good at it and achieving something. So boost your self-esteem. We can actually take care of our mental health when we care for others. And this is a great tip that I think everybody can be involved in because we have so much family and friends around us. So caring for others is often an important part of keeping up relationships with who we love. It can even bring you closer together. My final tip for maintain your mental health, yet the most important one, is asking for help. So no one is perfect. We're all sometimes get tired or get overwhelmed by how we feel or when things go wrong. So if things are getting too much for you and you feel you can't cope, please ask for help. And more importantly, don't be ashamed of it, because the only thing you will lose is your health. Dear listeners, a healthy mind is the greatest treasure to find. And if you feel like life is sinking, try positive thinking. Thank you for listening, and remember to join us every Sunday at 3 p.m. to hear more about health and healthy lifestyle. For any comments or questions, please visit our Facebook page at Healthy Living JUFM. For next time, have a cheerful and warm day. Bye-bye. Do you know what healthy living is all about? Do you want to know how can you live happier and longer? How about learning about balance, spirituality, and prevention? To know how you can live in harmony with others and how to add balance to your life? Know more about prevention and many, many more of the health topics?
Make sure to listen to Healthy Living. Every Sunday at 3 p.m. on 94.9, the JU radio station. Will be rebroadcasted on Tuesdays at the same time. Healthy Living, prepared and presented by Fida Amin.